Williamsville offers at least 18 hours of individual therapy per week versus an industry average of 1.5 hours weekly. Our patients usually see on average 8 different therapists per week, each with a different area of expertise, such as trauma, PTSD, or anger management, just to name a few. When choosing a treatment facility, we encourage people to decide which treatment method they feel will work best for them. Primarily group sessions or one-on-one individual treatment. In groups, a person really has the choice to hide, take over the group, or have the right interaction. We feel each person's addiction is unique to them, and therefore they're most likely to respond to the therapy that addresses their own personal issues within a one-on-one session. We're also a very small facility. We accept a maximum of 8 patients per property. Our patients are able to be treated for their addiction on a very personal level. They're not just a number here. Our main goal is to get the patient to be honest about their addiction and the issues they have in their lives. A patient would have a difficult time manipulating or lying to 8 or more therapists, so the sharing of sessions allows the team to focus on real, honest problems, generally the ones that the patient has been avoiding.
You say the team, isn't it really about the case manager running the patient's schedule?
Well, this is another way that Williamsville is different. We truly use the team concept. As an example of this, it's our treatment team has a daily working lunch where they're able to discuss patient updates and treatment plans, because there's no way for us to know which therapist the patient will bond with early on, or if that relationship may change while the patient is here. We also want the patient to feel comfortable in calling their favorite therapist after he or she leaves Williamsville. What is in the best interest of the patient drives their daily schedule. We are licensed by the Commonwealth of Virginia as a residential treatment facility that treats gambling addiction, alcohol abuse, chemical dependency, and other impulse control disorders. One reason you haven't heard of this is because we are the only residential treatment center in the United States that has a license to treat gambling addiction, and one of only a handful to have a license to treat impulse control disorders. To treat both populations effectively, you need to focus on individual therapy. In the 40s, all addiction was considered an impulse control disorder, and it is our belief at Williamsville that impulse control plays a part in all addictions.